Hello, and today we'll be talking about epistaxis. Epistaxis can be anterior or posterior. They are bleeds from the nose, mostly benign and self-limiting. They can be recurrent, and many often go unreported and self-resolve. 90% are anterior nasoseptal bleeds in the Kesselbach's plexus, especially in small children. These are visible and less severe. The posterior ones are rapid. The patients can swallow blood and can be commonly unseen. Epistaxis can commonly be due to trauma, dry nasal mucosa, septal deviation, antiplatelet medications, and rhinitis. The treatment is direct pressure and topical vasoconstrictors such as phenylephrine or oxymetazoline. Anterior nasal bleeds, you pinch the nasal alar for 10 minutes with the patient upright, or you could use a nasal tampon insertion. For posterior nasal bleeds, this is difficult. You could use nasal balloons, IV sedation, and analgesia may be required, and even patient hospitalization. If the bleeding doesn't stop, then you can cauterize with silver nitrate. If severe, you screen, gain IV access, and consult an ENT surgeon. Red flags include multiple recurrences, cutaneous signs such as ecchymosis and petechiae, which are signs of bleeding disorders, so you'd need a PT and a PTT, as well as checking the INR. You'd also request a complete blood panel, complete blood count as well. For treatment-resistant bleeding, that can also be seen as a red flag. Signs of hypervolemia such as clammy hands, dry mucous membranes, lack of tear production as well. Additional information includes you should ask your patients about aspirin, ibuprofen, or anticoagulant use. Most nosebleeds are anterior and treated by directly providing pressure. You should also screen for bleeding disorders. Another syndrome, called Rendu-Osler-Weber syndrome, is considered as bleeding and arteriovenous malformations, which can be treated by laser photocoagulation, and that can present with epistaxis. You also would do a CT if a foreign tumour or body or sinusitis is expected, and blood replacement for anemia after getting the hemoglobin levels and the physical examination. Thank you very much.